In healthcare, delays don't just waste time, they can change outcomes.
Introducing Pathfinder Triage, an AI-powered emergency triage and intelligent hospital coordination platform designed to transform how patients are assessed, prioritized, and connected to care. Every emergency begins with uncertainty. Who needs immediate attention? Who can safely wait? And how can hospitals make that decision before a patient even reaches the reception desk? This is where Pathfinder Triage begins. Every emergency begins with reliable communication. Before the triage session starts, Pathfinder Triage captures a verified emergency contact, creating a secure session while enabling real-time SMS updates throughout the patient's journey. Rather than overwhelming the patient with long forms, our AI conducts a dynamic clinical interview. Each follow-up question is generated to reduce diagnostic uncertainty, collecting only the information needed to build an accurate clinical profile. While the conversation is still in progress, the back end is already working. Incoming symptoms are analyzed in real time, allowing the hospital dashboard to predict which departments may soon receive critical patients. This gives medical staff valuable time to prepare before the patient even arrives. To minimize AI hallucinations, language understanding is separated from medical reasoning. Patient symptoms are converted into standardized clinical tokens and matched against the DDX Plus medical dataset, using a FAISS vector search engine, producing a deterministic differential diagnosis rather than a purely generative response. At the same time, the hospital receives a live notification containing the patient's condition, urgency level, and estimated arrival. This enables reception teams to prepare resources before the patient reaches the hospital. Before the result reaches the patient, an independent clinical watchdog validates every diagnosis against established WHO and ICMR medical guidelines. If a critical condition is underestimated, the system immediately overrides the urgency level to prioritize patient safety. The absolute hallmark of this system is the trifactor telemetry matrix. Displayed at the base of the terminal, we treat the patient as a multi-dimensional data canvas. First, live priors apply a Bayesian probability shift by factoring in geospatial location and seasonal epidemiological data. Second, statistical differentials map out the exact mathematical probability distribution of potential underlying conditions. Third, and most uniquely, the behavioral coherence engine acts as a digital lie detector, parsing keystroke intervals, response latencies, and vocal audio energy. If a patient textually understates or overstates their condition, this panel catches the discordance between human words and behavioral biomarkers, protecting the system from cognitive bias. By aggregating live triage sessions across the hospital, Pathfinder Triage transforms patient intake into a predictive operational system, helping administrators anticipate demand and allocate medical resources more effectively. Finally, the complete triage session is packaged into a secure report with a QR code. A simple scan at the hospital instantly restores the patient's assessment, reducing paperwork, minimizing repeated questioning, and helping clinicians begin treatment without delay. Pathfinder Triage bridges the gap between AI-driven virtual assessment and real-world clinical care, helping hospitals respond faster, clinicians make safer decisions, and patients receive timely treatment when every second